It is a great pleasure to introduce you to this amazing book. It's the Xanthelasma book. This is a book that I've written myself in 2013 and is on xanthelasmaremoval.com. So we made it into a book now, so you can digest it, so you can read it. We also made it into a video book, and we made it available on Audible. You can buy it from Amazon and in Kindle version as well. But for you, as usual, you can download this book as a PDF for free from the link below. So once again, to you it's for free. To you that you follow us for so many years, very likely, to use for free. Get the ebook PDF on the link below. Okay. Thank you for following us.
Title: Xanthelasma, an aesthetic affliction of the past. Author: Andreas Russo. Written by Andreas Russo. Narrated by Andreas Russo.
About the author, Andreas Russo. Andreas Russo has been the owner and managing director of Areton Ltd and other limited companies. He speaks English, Italian, Spanish, Portuguese and Chinese. He has great knowledge on the use of electrical arcing for the removal of xanthelasma, and he is the creator and formulator, the person who calibrated the formulation, of the xanth remover, the Xanthelasma home removal solution. He is the author of voltaicplasma.com and the first plasma fibroblast Bible. He is the creator of the BeautyTech plasma pen, the Bay Cream, the aftercare product for several types of aesthetic treatments, and more. He is also a professional property developer and investor. The origins of this book. In 2013, after publishing videos on social media about xanthelasma and xanthelasma removal, and about the use of electrical arcing for xanthelasma removal, Andreas Russo noticed a great demand for a home xanthelasma removal solution. This is because several people had xanthelasma and cosmetic clinics would charge an arm and leg for this very easy procedure. This was outrageous because xanthelasma removal is relatively inexpensive if you have the right knowledge and if you use the right methods or products. For this reason, Andreas Russo wrote the content in xanthelasmaremoval.com. The content of the website is now compiled here for you to study and absorb. Note that before xanthelasmaremoval.com there were no organized information about all the possible ways to remove xanthelasma. Because of this, also doctors and aesthetic practitioners were not well informed on the way to remove these lesions. Because of this lack of knowledge, xanthelasma removal procedures were expensive. Here you will find all about the most effective ways to remove xanthelasma. In short, the main purpose of this book is to make professionals and the public aware of all the most effective ways to remove xanthelasma, so that xanthelasma removal is not as expensive as it used to be. This book is suitable for everyone affected by xanthelasma and aesthetic practitioners wanting to learn all about the techniques available to remove them effectively. As you will see in this book, xanthelasma are very easy to remove effectively. There are many techniques available to remove them, and some of them are more costly than others, leading to different results. This book will explain in detail how each procedure is carried out, its effectiveness, and the likelihood of leaving scars. We talk about lasers, electrical arcing removal, removal using surgery, and most of all, the most simple and cost-effective methods to remove them at home by using specialized cosmetic peels. This book also talks about the xanth remover, which is the easy and effective home xanthelasma removal solution. The xanth remover was first introduced in 2013 and it helped thousands of people the world over to remove their xanthelasma from the comfort of their own home. Chapter 1. What is xanthelasma? Xanthelasma, called by specialists Xanthelasma palpebrarum, is a particular type of xanthoma, a yellowish deposit of fat underneath the skin, usually on the eyelids and or around them. Therefore, xanthelasma can be referred to as xanthoma, but not vice versa. The process in the formation of xanthelasma and xanthoma are the same, but we refer to xanthelasma only once the xanthoma develop around the eyes or on the eyelids. Xanthelasma are composed of xanthoma cells, which are foamy formations which intracellular fat deposits primarily located within the upper reticular dermis and epidermis. Put more simply, xanthelasma are collections of certain types of fat, mostly cholesterol and triglycerides derived from food. Illustration 1. Xanthelasma appears on upper and lower eyelids. These lesions appear in those individuals whose body is unable to efficiently break down fats into usable energy. Sometimes diabetes, hyperthyroidism, liver problems, and mostly genetics can all contribute to the growth of xanthelasma. Recently, the role of LDL and macrophages with their scavenger receptors has been observed as a probable causation of Xanthelasma palpebrarum. Since xanthelasma are fat formations, they have little nervous terminations, therefore they are not painful. The incidence of xanthelasma in the general population has been reported between 0.3% and 1.5%. The age onset ranges from 15 to 73 years, with a peak incidence in the 4th and 5th decade. Throughout our experience in treating this condition, xanthelasma appear to be lesions predominantly observed on female adults. Although this higher reported incidence has been corroborated by independent studies, this may be due to the fact that women are more self-conscious of cosmetic conditions than men. Due to the type of customers we have served, we can now say xanthelasma are equally common in Asians, Caucasians, and people from any ethnic origin. Many still believe that the formation of xanthelasma are directly related to the cholesterol levels of the individual, contributing to the development of the condition. However, a direct correlation between high lipids levels and the formation of xanthelasma has not been proven. It has been found that many of those developing xanthelasma have normal cholesterol blood levels. Illustration 2. Xanthelasma on upper eyelids. It seems instead that certain individuals are more likely than others to develop xanthelasma, mainly due to hereditary factors. This is confirmed by studies conducted on a large number of people who developed the condition. It has been found that the high cholesterol incidence level of the xanthelasma sufferers is close to those of the normal population not developing xanthelasma. Therefore, unless proven otherwise, it is possible that high cholesterol levels and the development of xanthelasma may not be directly correlated. On the contrary, there seems to be a hereditary component which contributes to the development of the condition. Hence, should a close relative be affected or was affected by the condition, you will be more likely to develop xanthelasma, despite your cholesterol levels. Only when there is no family history of xanthelasma, the condition could be related to high cholesterol levels. Illustration 3. Xanthelasma on the upper and lower eyelids. The xanthelasma condition is usually assessed by family doctors and dermatologists. However, given that there is little research done on xanthelasma, the advice offered by many not be in the best interest of the patient. In fact, some practitioners have advised their patients that it is too risky to have their Xanthelasma treated because they could end up being scarred in the process. This advice had been offered because there is no inherent health risks in keeping the Xanthelasma benign growths, and little information is available on how to have Xanthelasma properly removed. However, it has been proven that when removed with the latest treatments, the risks of scarring are remote. For a long time, Xanthelasma have been referred to as an indicator of potential high risks of cardiovascular disease, strokes, and heart attacks. However, to this day, no scientific study has been carried out to corroborate the link between Xanthelasma formation and cardiovascular diseases. Nevertheless, many still say that those affected by Xanthelasma are more likely to die younger due to heart attacks or strokes. Initially, this alleged higher mortality of those affected by Xanthelasma was believed to be due to the high cholesterol levels of those affected by Xanthelasma. Illustration 4. Xanthelasma on the upper eyelid corner. After all, the common belief was that high cholesterol levels caused the Xanthelasma formation in the first place. However, no evidence of this has been found, especially given that the cholesterol levels of many affected by Xanthelasma are normal. A study was carried out showing an association between Xanthelasma formation and cardiovascular disease. In this study, it is shown how similar the Xanthelasma and Xanthoma development process is to the formation of plaques within the arteries. Lately, a study has associated the formation of Xanthelasma with a 17% greater risk of mortality due to cardiovascular diseases when compared with those without Xanthelasma. Xanthelasma appear on both eyes symmetrically in the vast majority of the cases. It has not been reported a case of Xanthelasma on one eye only without the other eye being affected. However, it has been reported of people who developed Xanthelasma without ever developing Xanthelasma and vice versa. Although Xanthelasma are skin lesions, fortunately, usually they are relatively superficial and they do not grow too deeply into the dermis. Illustration 5. Xanthelasma appears on upper and lower eyelids. Xanthelasma usually reside between the superficial part of the dermis and the epidermis in the same fashion as common warts. Therefore, the successful treatment and removal without scarring is feasible and not uncommon. Chapter 2. What is xanthoma? Xanthelasma are a particular type of xanthoma. Xanthoma can appear on any part of the human body and are addressed to as xanthelasma whenever they appear on the eyelids or around the eyelids. Illustration 6. Watch the video on xanthoma. Xanthoma are fatty growths underneath the skin. These growths can appear anywhere on the body. Basically, it is a fatty growth that starts accumulating below the skin and ultimately protrudes from the surface of the skin. Xanthoma are fatty patches inside the skin. Xanthoma can vary in size. These growths may be as small as a pinhead or as large as a grape. Illustration 7. What are xanthoma video? They often look like a flat bump under the skin and sometimes appear in yellow or orange color. These are usually not painful, however, they might be tender and itchy. They can grow in clusters in the same area or several individual growths on different parts of the body. 2.1. Where can they appear? These growths can appear anywhere on the body, but they typically form on the joints, especially the knees and elbows, hands, buttocks, feet. Xanthoma may appear as single lesions or as a cluster. It may develop on one part of the body or can affect different parts. These lesions can appear in different shapes and sizes. Some people may have a xanthoma which is as large as grapes, whereas others can have xanthoma as small as a pinhead. Usually, these lesions appear as small bumps inside the skin which may be yellow or orange color. These lesions can be itchy and may be slightly tender to the touch at times. However, mostly they are not painful at all. 2.2. What are the causes? Xanthoma is usually caused by high levels of blood lipids or fats. This may be symptom of an underlying medical condition such as hyperlipidemia or high blood cholesterol levels, diabetes, a group of diseases that causes high blood sugar levels, hypothyroidism, a condition in which the thyroid doesn't produce hormones, primary biliary cirrhosis, a disease in which the bile ducts in the liver are slowly destroyed, cholestasis, a condition in which the flow of bile from the liver slow or stops, nephrotic syndrome, a disorder that changes the blood vessels in the kidneys. Illustration 8. Xanthoma on knee. Hematologic diseases. These are genetic conditions that affect the body's ability to break down substances and to maintain important bodily functions such as digestion of fats. Cancer, a serious condition in which malignant cells grow at a rapid and controlled rate, side effect of certain medications such as tamoxifen and others. 2.3. Types of xanthoma. There are many kinds of xanthoma. Some are differentiated based on their color. Others are differentiated based on their causes, and there are some others which are differentiated based on their shape. Tuberous Xanthomas. Xanthomas, like a tumor, are a collection of foamy histocytes in the dermis. They may be associated with familial or acquired disorders resulting in hyperlipidemia with no underlying medical disorders. Tuberous xanthoma form as yellow nodules and are frequently associated with hypertriglyceridemia, but they are also seen in patients with hypercholesterolemia. Illustration 9. Tuberous xanthomas. We have presented a case of multiple tuberous xanthoma in a subject with normal lipid metabolism and with no associated systemic disorders, which is an uncommon occurrence. This case is being reported because it's a rare occurrence. The aim of this report is to emphasize that the patient has a normal lipid profile. Causes of tuberous xanthoma. All xanthoma are primarily caused by elevated levels of fat in the blood and body. This leads to excessive deposition of fat in tissues, the production of foamy cells, and eventually xanthoma. Here, some factors are responsible for the predisposition of developing xanthoma. Obesity, elevated levels of lipids and cholesterol in the blood are responsible for this condition that result in the availability of fats for consumption by macrophages. Hypercholesterolemia, the elevated cholesterol in the blood, which leads to the deposition of cholesterol crystals in the body, which is consumed by macrophages and clustered as foamy cells and ultimately become xanthoma. Genetic diseases and familial conditions may lead to elevated levels of lipid in the blood and hence predispose to the development of tuberous xanthoma. Symptoms of tuberous xanthoma: gross deformity. The lesions can look unsightly and are a cosmetic disfigurement. In such cases, patients usually seek help. Painless. The lesions of tuberous xanthoma are not painful and usually resolve after lipid abnormalities are corrected. Hyperpigmentation. The tuberous xanthoma or plaque can lead to increased pigmentation, which causes cosmetic disfigurement. Tendinous xanthoma. Xanthoma are commonly caused by excess lipids in the body which are not metabolized correctly. Tendinous xanthoma are cholesterol deposits in tendons. They appear as enlarging papules or subcutaneous nodules attached to tendons, ligaments, fascia, and commonly affect the tendons of the dorsal surface of the hands and the Achilles tendon. Their presence is a possible clinical sign of familial hypercholesterolemia, high LDL cholesterol levels, and premature cardiovascular disease. Illustration 10. Tendinous xanthoma. As mentioned earlier, they appear as subcutaneous nodules attached to tendons or ligaments. The yellow plaques occur most commonly in the hands, feet, and calf muscles. They are primarily attached to the tendons and are commonly found in the ankle and the extension tendons of the fingers. They may be correlated with hypercholesterolemia and enhanced LDL levels. Plane xanthomas. Plane xanthomas are the flat type of xanthomas which can appear anywhere on the body. However, depending on where they grow on the body, this type of lesions grow due to certain particular causes. So depending on the location of these types of plane plaques, the possible underlying causes can be sometimes identified, but not always. Diffuse plane xanthomas. Diffuse plane xanthoma was first described by Altman and Wickelmann in 1962. It is an uncommon subtype of xanthoma characterized by diffuse plane xanthoma of the head, neck, trunk, arms, and legs. They can develop while having normal cholesterol levels. This type of xanthoma typically appear first on the neck and upper trunk. These lesions are due to a rare type of macrophage dysfunction. The defect results in the presence of an abnormal antibody in the blood called a paraprotein. This kind of xanthoma can be correlated with certain types of cancers, meaning that people with diffuse plane xanthomas can have a higher likelihood of developing cancer. This type of xanthoma can also develop on the neck, face, chest, buttocks, armpits, and groin. Illustration 11. Diffuse plane xanthomas. Eruptive xanthoma. Eruptive xanthomas are red to yellow papules appearing on large clusters over the buttocks, shoulders, arms, legs, or even the whole body. In certain cases, this xanthoma may appear in the mouth as well. Illustration 11. Detail of eruptive xanthoma. These xanthoma are usually tender and can be itchy and sometimes disappear over a few weeks. This xanthoma can be correlated with hypertriglyceridemia and also with diabetes. These xanthoma are small yellowish papules that occur in large numbers in the same area on the body, in clusters, so to speak. They are primarily found on the buttocks, but can also be found on the shoulders, legs, and arms. They develop in small crops and are an abnormal deposition of lipids in the skin. Sometimes these papules can also occur in the mouth and can look like ulcers. Another common feature of eruptive xanthoma that sets it apart from most other types of xanthoma is its ability to cause itch. These lesions can be also tender. It is therefore important to differentiate them from other skin conditions which may not be benign. To summarize, eruptive xanthoma are lesions which typically erupt in groups of small red yellowish papules. Most commonly come up on the buttocks, shoulders, legs and arms, but might develop all over the body. Benign lesions that may be sensitive and usually itchy but benign. Strongly linked with hypertriglyceridemia, increased triglyceride levels in bloodstream, often in patients with diabetes. Causes of eruptive xanthoma: familial hypercholesterolemia type 2. The disease is caused due to a genetic abnormality in LDL receptor that results in elevated levels of this fat in the body. Broad beta hyperlipoproteinemia, caused due to a protein mutation that causes elevated levels of triglycerides and cholesterol, exaggerating the condition. Hypertriglyceridemia, which commonly leads to hypertension, obesity, and diabetes. Elevated levels of fat in the blood may contribute to the formation of xanthoma. Diabetes. The excessive sugar is converted into fats and the tissues are surrounded by an inflammatory reaction that is difficult to control, leading to eruptive xanthoma. Xanthoma in the Achilles tendons. Xanthoma can appear on any part of the body. They are also commonly found in the Achilles tendon. When xanthoma appear on the Achilles heel area, they are found pressing on the tendons underneath the skin. The main peculiarity of this type of xanthoma is that it grows underneath the dermis, whereas most xanthoma are found between the dermis and epidermis. When found on the Achilles tendon, this xanthoma can cause particular discomfort to the patient. The patient may request to have them removed because of the discomfort while walking and running. However, xanthoma are benign and therefore can be left untreated without compromising the longevity of the patient. Sometimes xanthoma in the Achilles heels can keep growing over time if left untreated. The only treatment known to date, apart of dietary and lifestyle changes, is surgery. Surgery for this type of condition is only advisable once the condition becomes too discomforting to the patient. This is because, despite the simple procedure required for this type of xanthoma removal, any surgery presents risks. Achilles heel xanthoma surgery is particularly safe to perform because no general anesthetic is required unless the xanthoma is particularly large. The area affected by the xanthoma is not close to any important artery. Illustration 14. Particularly enlarged xanthoma in the Achilles tendon. MRI and surgery. As we can see from the below picture, The footwear worn by the patient over time can affect the way the xanthoma develop. Surgery for removal of this type of xanthoma will lead to scarring. This is because of where the xanthoma grows on the Achilles heels inside the skin beneath the dermis itself, and therefore the scar left will be due to the deep incision required for this xanthoma removal. This xanthoma MRI shows clearly how this type of xanthoma develops inside the skin and presses on the tendons, figure A and B. Illustration 16, xanthoma figure A. Illustration 15, xanthomas, MRI, figure B. From the patient's MRI, figure B, we can see the Achilles heel xanthoma pressing on the tendon. However, there is another xanthoma growth underneath the plantar heel. Given that after surgery the patient will not be capable of walking until the xanthoma underneath the plantar heel has completely healed, the xanthoma should only be removed if this condition becomes particularly bothersome to the individual. The picture on the right shows a large xanthoma removal. The surgeon might decide to perform this procedure under general anesthetic for large xanthoma removal. This procedure will inevitably leave scarring to the individual. Illustration 17. Surgery xanthoma removal in the Achilles tendon. However, the benefits of the surgery far outweighed the small risks in this case. Xanthoma can develop on any part of the body. They have different characteristics depending on the area where it is found. While xanthoma on the Achilles tendons grow underneath the dermis, fortunately, when finding them on other parts of the body, they develop between the epidermis and the dermis. This, therefore, allows possible xanthoma removal without leaving any scar. Illustration 18. Xanthoma on elbow. As we can see, in this particular case, the patient affected is of athletic type and does not have high cholesterol levels due to his physically active lifestyle. The xanthoma have appeared despite of this healthy lifestyle. Xanthoma can also appear on the back of the hands. Removal of this type of xanthoma is possible with lasers, hyfricator, and other similar equipment by superficial ablation. The operator can assess the risks of scarring depending on whether the xanthoma has affected the dermis. As stated earlier, with the exception of planar xanthoma, including Achilles heels, tendon xanthoma, xanthoma develop superficially between the dermis and epidermis. Illustration 19. Xanthoma on hand. Normally, an experienced dermatologist can assess the risk of scarring by looking at the lesion. The rule of thumb to follow in order to assess the risks of scarring after xanthoma removal procedures is that the more superficial the lesion, the less the risks of scarring. In case it is not possible to see the corrugation on the lesion, this means that the lesion could have grown deep into the skin and maybe underneath the dermis, but fortunately this is very rare. Therefore, a deep incision is rarely required to remove the xanthoma, and a simple superficial ablation will often suffice. This case is not only a further demonstration that xanthoma can appear anywhere on the body, but also can be developed by individuals that are neither overweight nor have high cholesterol levels. Xanthoma removal of this type is normally successful by simply using superficial ablation. However, given the extent of the area to be treated, a number of sessions to achieve complete removal may be required. By all means, it is possible to remove all xanthoma from such a large area in a single session. This main drawback when using electrical arcing or lasers is the relatively large extent of the burns that the patient is subjected to within one session. Such a large amount of burns could pose the body to needless stress, which should be avoided. This further example shows how xanthoma can develop also at a young age. The removal of this type of xanthoma is also sometimes possible by using superficial ablation as well as specialized peels. Illustration 21. Xanthoma on eyeball. Illustration 22. Xanthoma on buttocks. Fortunately, these types of cases are quite rare. This young patient presented overgrown xanthoma on the buttocks. The best proposed removal solution would be conventional surgery under general anesthetic. However, an MRI would be advisable before scheduling surgery. The MRI will provide important information concerning these benign growths inside the patient's body. As we have seen, xanthoma are not only a skin condition. It can grow in the eyeballs and other parts of the body. Illustration 23. Gastric xanthoma. Xanthoma can also grow on internal organs. This is a case of gastric xanthoma found by sheer chance. Of course, this type of xanthoma does not need to be removed as it will not cause any threat. The picture below clearly demonstrates that xanthoma are not a condition exclusive to us humans. Therefore, if you ever develop or you have xanthoma, you know that there is little to worry. Many people have it, and you may even not know about it. How is xanthoma diagnosed? Your doctor or dermatologist can easily diagnose xanthoma if they are trained appropriately. They may be able to make a diagnosis simply by examining your skin. A skin biopsy can confirm the presence of a fatty deposit beneath the skin. During this procedure, your doctor will remove a small sample of tissue from the growth and send it to a laboratory for analysis. Your doctor will follow up with you to discuss the results. They may also order blood tests to check blood lipids levels, assess liver function, and rule out diabetes. What causes xanthelasma? High LDL, bad cholesterol, or low HDL, good cholesterol. Inherited high cholesterol. Your doctor might call this familial hypercholesterolemia. The liver disease called primary biliary cirrhosis, which can raise cholesterol levels. Deficiency of familiar lipoprotein lipase, the enzyme that breaks down lipids. Familial hypertriglyceridemia, a genetic condition that causes people to have higher amounts of triglycerides in their blood. Familial dyslipoproteinemia, a genetic condition that causes people to have higher amounts of lipids in their blood. Illustration 24. Cholesterol levels by age. Lifestyle factors that increase the likelihood of developing xanthelasma may include diets high in saturated fats and low in unsaturated fats, excess alcohol consumption, lack of cardiovascular exercise, weight gain, a diet low in fiber, smoking. Illustration 25. Cholesterol deposits. Who gets xanthelasma? This condition is rare, but you can sometimes get it if there is high levels of cholesterol or other fats in your blood. It is also possible to get it even if your cholesterol levels are normal. Most people who get it are middle-aged or older. It is more common in women than in men. If you have it, you should have your cholesterol checked with a blood test. Illustration 26. Xanthelasma on eyelids. Xanthelasma are most common among people whose families are from Asia or the Mediterranean. When should I go to the doctor? Xanthelasma might be an early cautioning sign that cholesterol levels have begun to increase in your blood vessels. After some time, cholesterol can frame hard sticky gunk called plaque in your arteries. This development is called arteriosclerosis, and it can lead to heart disease or stroke. Illustration 27. When should I go to the doctor? Xanthelasma treatments. Type of treatments proven to work. The available treatments that are scientifically proven to work are only surgical excision, removal using lasers, electrical arcing, electrolysis, chemical peels. There are also some treatments which some people have said they worked for them. However, they have not led to consistent results. These are cryotherapy, the use of castor oil, and the use of garlic. What are the chances of scarring after xanthelasma treatment? The chances of scarring after undergoing xanthelasma treatment depend on the type of treatment, whether any damage was caused to the dermis during the treatment, and infections following the treatment. TCA, trichloroacetic acid peels in clinics. TCA allows easy removal of xanthelasma, usually within 1 or 2 treatments. This makes the product very successful within cosmetic clinics because the client can see the results soon after the first session, and the results are achieved within a relatively short time frame. However, TCA is not very easy to control, and compared to other types of cosmetic peels, it could be too aggressive on certain skin types and more prone to cause hypo or hyperpigmentation than other types of peels. Therefore, it may not be the best option for home use, given that there are milder peels available on the market which are easier to control. However, several people have purchased TCA peels and removed their xanthelasma from their own home. Illustration 29. Watch video on this topic. Xanthelasma laser treatment. Illustration 30. Watch our video on this topic. Xanthelasma laser treatment is very effective in removing xanthelasma, but it is very expensive. This xanthelasma laser removal method is similar to electrolysis or electrical arcing in removing xanthelasma, but slightly more difficult to perform and also more dangerous. Xanthelasma surgical excision. Xanthelasma excision using a scalpel. This is the oldest method of removing xanthelasma. It consists in using the same procedure used for skin cancer excision. This is a very effective procedure in removing xanthelasma within 1 session. However, it is very invasive. Bleeding will inevitably occur during the surgical procedure. The use of local anesthetic is mandatory. There are risks of infections. The procedure will almost inevitably scar the patient. This type of procedure is to be avoided due to the high chances of scarring. Given all the modern techniques available, there is no reason for this type of treatment to be used any longer. Illustration 32. Surgical excision. Illustration 33. Surgical excision. Illustration 34. Surgical excision again. Xanthelasma removal using electrical arcing. Electrical arcing, also referred to as fibroblast, is one of the newest and most cost-effective ways to remove xanthelasma. This method has become more and more popular from 2015, and it has revolutionized the way to remove xanthelasma in cosmetic clinics because it is inexpensive, easy to perform, and it rarely leads to scarring. In aesthetics, besides xanthelasma removal, electrical arcing is also used for tattoo removal, skin tightening, benign mole removal, skin lesion removal, and more. Illustration 35. Watch the video on this topic. Xanthelasma removal by freezing. This removal treatment involves freezing the xanthelasma with liquid nitrogen or another chemical. This type of treatment is also known as cryotherapy. Liquid nitrogen xanthelasma treatment is referred to as cryoxanthelasma ablation, and you will see this option come up from time to time. However, the dangers of applying extreme low temperatures to your eyelids and the disappointing results have made this removal treatment the least favored. It is simply too dangerous, destructive, and the results are unreliable. Illustration 36. Freezing treatment or cryotherapy. Effects of cryotherapy are difficult to control. Therefore, although it has been adopted as xanthelasma treatment in some clinics, it is not generally advisable to be used for xanthelasma removal for two reasons. Relatively high potential dangers to the eyes, even normal eye protectors used to protect the eyes during laser excision cannot protect the eyes against the deep cold of the cryosurgery. This treatment presents the highest likelihood of neither being suitable nor effective. The risks of infection after this type of procedure are very low. Xanthelasma treatment with castor oil. There are several effective ways to have xanthelasma removed. However, some people would prefer a more natural way to deal with their xanthelasma, which would lead them to consider castor oil. Although it is not shown to be very effective for xanthelasma removal, it is definitely worth a try. Illustration 37. Castor oil. Xanthelasma garlic treatment. Garlic reduces cholesterol and blood pressure. It is not going to hurt you taking garlic in an attempt to control your xanthelasma, as it can help you lower your cholesterol levels and it has other health benefits. Garlic is a great option to improve your health and reduce the detrimental effects of increasing cholesterol levels. Illustration 38. Garlic cloves. Some people have reported the use of garlic in a certain way effective in the removal of their xanthelasma at home. However, the results are very inconsistent. DIY xanthelasma treatment. How great would it be if we had a simple, inexpensive and easy to use method to remove xanthelasma from the comfort of people's home? So we would like to make life easier and most of all safer to all the DIY enthusiasts by publishing this information, which is worth thousands when you can manage to get rid of your xanthelasma. After reading this, you should be able to go and purchase all the ingredients yourself and treat your xanthelasma. We know that by following all these steps, you are very likely to get rid of your xanthelasma without leaving any scars and laugh at all those unnecessary expensive cosmetic clinics. However, it is always recommended to seek specialist advice because all the effective treatments for xanthelasma removal require ablation. The xanthelasma sufferer should be assisted in this process in order to remove xanthelasma in the safest possible way and avoid mistakes which could be paid in terms of unnecessary scars. Illustration 39. Watch the related video. For starters, you should know the basics about the removal of skin lesions. It does not matter how you will do it. It can be done using lasers, electrocautery units, eye fricator, other equipment, or cosmetic peels. What you are trying to do is ablating, destroying the lesion, and at the same time you should make sure of two things. Despite the ablation, the dermis has to remain intact and unaffected by the treatment. No infection should develop during the healing process. But this should not be your concern because peels rarely cause an open wound. Illustration 40. Xanthelasma on upper eyelids. Taking care of these two important points ensures that the risks of scarring are minimized. As mentioned earlier, infections are very unlikely using the methods proposed. Of course, if you used a laser or scalpel yourself, you would need to take care of infections. But we hope that no DIYer would venture to that extent to remove their xanthelasma because it is not necessary. Illustration 41. Watch the related video. Have your cholesterol levels checked first. If your cholesterol is high, then you should take action to lower it. It has been reported that some xanthelasma sufferers with high cholesterol levels managed to treat their xanthelasma by simply lowering their cholesterol. In some cases, this was done by mere calorie restriction. In others, by taking cholesterol-lowering drugs. Not everyone managed to have their xanthelasma to disappear, but some people experienced complete disappearance of their xanthelasma. We recommend lowering your cholesterol by adopting calorie restriction first. Cholesterol-lowering drugs should be prescribed by your doctor. If your xanthelasma do not improve by doing so, at least you reduced the likelihood of heart disease. Some of the people with xanthelasma have normal cholesterol levels. Therefore, lowering cholesterol is highly unlikely to work for everyone. Read more about xanthelasma and high cholesterol. Try garlic xanthelasma treatment second. We would like to point the DIY enthusiasts to garlic treatment first. This is because garlic is easily available and virtually harmless unless the garlic juice is in direct contact with the eyes. Please note that throughout our experience of treating xanthelasma, we have not yet found the scientific proof of this treatment efficacy. However, people keep asking about it. So, how to do it? All you're trying to accomplish is to have the garlic juice to be in direct contact with your xanthelasma for 10 to 15 minutes, once or twice a week. So, peel the garlic clove and crush it to make a fragrant juice. Then you can apply the juice onto your xanthelasma using a small handkerchief for 10 to 15 minutes or more. Make sure that you will never allow the juice to get in contact with your eyes, because this could potentially damage your vision permanently, so be careful. In case of contact with the eyes, rinse generously with tap water. Remember, what is natural might not be completely harmless. Lemon, for example, is natural, but if the juice gets into your eyes, it could turn you blind. Read more about garlic treatment. Illustration 42. Garlic treatment. After that, the area where you apply the garlic juice may redden and swell. When the skin returns to normal, you can repeat the process. Some people reported that xanthelasma progressively faded after each treatment. Some others, like us, reported no improvement whatsoever. Unfortunately, there are no studies to back any claims concerning garlic efficacy in the treatment of xanthelasma, and no sources could be independently verified as yet. Said that, garlic for xanthelasma treatment is worth at least a try. Specialized peels. The use of very specialized cosmetic peels to chemically ablate xanthelasma has been used for many years, and it does work. It will work because this is science. There are many research papers where scientists and researchers have used peels to remove xanthelasma. You can find the links as you read on this webpage. Remember what we said about removal of skin lesions. In order to decrease the likelihood of leaving any scar, we have to leave the dermis unaffected. Trichloroacetic acid has been used in clinics for a long time to successfully ablate and remove xanthelasma. There are many research papers that back up the use of this type of acids for effective removal of xanthelasma. Glycolic acid is another useful peel for a successful xanthelasma treatment and removal. Also, many other cosmetic peels are very effective in the treatment of xanthelasma. In a cosmetic clinic, the dermatologist will select the best peel based on the type of xanthelasma and type of skin. Read more about cosmetic peels in clinics. Not only has this type of treatment been used in many clinics for years, but also numerous research papers have confirmed the effectiveness of cosmetic peels to treat and remove xanthelasma. The results are repeatable and consistent. In order to ablate the xanthelasma within a useful time frame, strong acid concentrations are used for the treatment. The normal concentrations in cosmetic peel creams are not aggressive enough to ablate the xanthelasma quickly enough. In science, we find the cause of the desired effect. Then, in order to reproduce the effect, we have to reproduce the cause that produced it in the first place. In other words, given that this treatment is effective in clinics, it is also effective in your own home if you use the same principle used in cosmetic clinics. So, what is used in clinics? In cosmetic clinics, TCA and other peels are the preferred options for treating xanthelasma. After all we are doing is ablation, remember? This can be done in many different ways using acids, lasers, and so on. Also remember that we do not want to leave scarring at the end of the treatment. Illustration 43. TCA chemical peel. In order to avoid scarring, we have to leave the dermis unaffected. Now, the only problem we have is that the acid used to ablate xanthelasma have to be in concentration between 50 and 95% to be effective. These acids are potent ablators, and the wrong acid type and the wrong concentration for your xanthelasma or skin type could potentially affect the dermis. Also, using highly fluid solutions could be dangerous to your eyes. So, if you are determined to be doing it yourself and you are determined not to seek specialist advice, you could be placing your skin and your eyes under unnecessary risk. So, although you can purchase acids cheaply from the internet, we strongly recommend you to consult a specialist first. Within the price of the xanth remover, we help you by providing the best gel formulation for your xanthelasma and skin type. Also included in the xanth remover price, you have our professional service. So should you have any question or concern, we will be happy to help you throughout your treatment. In this way, you can remove your xanthelasma effectively without taking unnecessary risks, and you can do it from the comfort of your own home with all our support. So to summarize, you can purchase peels from the internet, a local laboratory or pharmacy at a very low price. The peel concentration varies from 50% to 95% depending on your xanthelasma and skin type. The type of peel selection and the other ingredients also depend on your skin type. Unfortunately, the cheap peels that you find on Amazon.com or eBay usually come in fluid solutions and not a gel as required for the safe removal of Xanthelasma. Additionally, these cheap peels are not conceived for this application, and they lack the important additives in order to make them suitable and safe for home use. What type of peel should you use? This depends on your skin type, your age, and type of Xanthelasma. You can choose TCA glycolic acid, mandelic acid, pyruvic acid, etc. If you use the wrong formulation, your skin on your eyelids and around your eyes could have permanent scars. What concentrations should you use? Again, this depends on your skin type, your age, and type of Xanthelasma. If you use the wrong concentration, you can easily scar your skin on your eyelids and around your eyes. How long should you keep the gel for? This depends on the type of formulation you are using, your skin type, and Xanthelasma. If you keep a strong peel for too long, it could lead to permanent damage to the skin around your eyes. Should you use a neutralizer? TCA solutions should require the use of neutralizers. If the right neutralizer is not used at the right time, the risks to the eyes are quite important because the effect of standard TCA solutions cannot be stopped by wiping it off. You require to use the right neutralizer at the right time. If you have any question throughout the treatment, you will have no support from the place you purchased the peel, so you can try to do it by yourself. However, given the above risks, we strongly recommend you to seek specialist advice first before trying any strong peels on your own skin. It does not matter whether the advice comes from Areton through the Xanth Remover or other specialists, as long as you are advised by the specialists. TCA peels for Xanthelasma removal. In this section, we will get into more detail about the trichloroacetic acid, or TCA. TCA allows very easy removal of Xanthelasma, usually within 1 or 2 applications. This makes the product very successful within cosmetic clinics because the client can see the results soon after the first session, and the results are achieved within a relatively short time frame. However, TCA is not very easy to control, and compared to other types of cosmetic peels, it could be too aggressive on certain skin types and more prone to cause hypo or hyperpigmentation than other types of peels. Therefore, it may not be the best option for home use, given that there are milder peels available on the market which are easier to control. Said that because TCA is very easy to purchase on the internet and other sources, it has been used by several people the world over in order to remove their own Xanthelasma at home. What is TCA and its applications? TCA is a non-toxic chemical trichloroacetic acid which has been used to perform skin peels since the 1980s. It is a relative of vinegar acetic acid. When TCA is applied to the skin, it causes the top layers of the cells to dry up and peel off over a period of several days to 1 week. When the old skin is peeled off, it exposes a new layer of undamaged skin. This has a smoother texture and more even color. Some dermatologists, in fact, still prefer TCA peels for treating some damage or melasma, usually in combination with prescription creams. TCA peels are safe in the hands of an experienced dermatologist. TCA peels may be a good option, particularly if you have xanthelasma. When it comes to cosmetic peels for xanthelasma removal, usually the main choice in cosmetic clinics is the use of TCA-based peels. This is because, if used properly, at the right concentration, TCA allows removal of the xanthelasma in 1 or 2 sessions only. This is ideal to both the cosmetic clinics as well as the customers because this achieves the best possible results within 1 session. However, if the concentration is too high and the application of the TCA is not done appropriately, the cosmetic procedure could result in mild scarring, a very rare occurrence. On the other hand, if the concentration of TCA is too low, the results will not be apparent and the client will not be satisfied. So, by using the right concentration of TCA, it is possible to remove the xanthelasma in 1 or 2 sessions. TCA is the best choice in cosmetic clinics because the results are achieved and appreciable in a short time frame and few sessions. TCA drawbacks control. Although very effective in the removal of xanthelasma, the use of TCA requires a certain amount of experience and training to use it appropriately and achieve good results. This is because TCA is very effective but not as easy to control, and for this reason neutralizers sometimes need to be used during the cosmetic procedure. The main reason for the sort of control difficulty of TCA is that it is not as easy to neutralize by using water like glycolic and mandelic acid, for example. These are some of the effects of TCA for xanthelasma removal. Excessive eyelid swelling. This occurs 1 or 2 days after the application of TCA on the upper eyelids. Stinging, numbness and burning of the skin. Excessive skin peeling. Redness, which can range from the color of a mild sunburn to a deeper red depending on the TCA concentration used. Crusting or scabbing of the skin due to skin cells being removed. Increased photosensitivity, sensitivity to the sun that can lead to hyperpigmentation. In some cases, when someone has sensitive skin, scarring or dermatosis, pigment problems can also potentially occur. Additionally, as stated above, TCA is not very easily controllable, and the most effective way to stop its acidity is to use a neutralizer. Please note that rinsing TCA with water and drying the area can help but will not stop the effects of TCA immediately. How do TCA peels work and what are the different depths of peel? All peels work by removing a layer of sun-damaged skin or a layer of skin. Superficial or light peels remove only the top layer, mostly the layer of dead skin called the stratum corneum. Progressing from the medium to deep peels, the layer of skin removed is greater with each increase in strength of the TCA peel solution. The stronger the TCA peel solution, the greater the risk of complications like uneven pigmentation or even scarring after xanthelasma removal. TCA peels can be performed at different skin depths from shallow to deep. Most dermatologists now are using laser technology or electrical arcing instead of deep TCA peels for xanthelasma removal. Illustration 46. TCA peels treatment on xanthelasma. Difference between TCA and glycolic acid. Illustration 47. Watch our video. Laser ablation for xanthelasma removal. Xanthelasma laser treatment is very effective in removing xanthelasma, but it is very expensive. The xanthelasma laser removal method is similar to electrolysis or electrical arcing when it comes to remove xanthelasma, but slightly more difficult to perform and also more dangerous. Laser ablation. A laser works by radiating a wavelength of high energy light. Its wavelength is measured in nanometers, nm. Lasers have many different functions in the medical and scientific field. These lasers generally work in different ways. Different manufacturers have different settings and parameters. Therefore, lasers can operate having different functionalities depending on the type of device. Laser ablation has been used to burn xanthelasma off for a number of years now. Some manufacturers claim that after xanthelasma removal, these lesions do not recur. However, this is not true, as we have had several people who reported xanthelasma recurrence after laser removal. The most common lasers used for xanthelasma removal is CO2 laser. Other types of lasers, although sometimes used for xanthelasma removal, are rarely the norm in this type of procedure. Illustration 48. Xanthelasma laser removal treatment. What is a CO2 laser? CO2 lasers are the preferred devices used in xanthelasma laser removal. This treatment is very effective due to the ablative nature of CO2 lasers. Rarely other types of lasers are used for xanthelasma removal. CO2 is considered the gold standard ablative laser. The vaporization of water within cells results in the ablation of the skin layer. Given its efficacy in removing skin lesions, a number of studies using CO2 lasers to remove xanthelasma confirm their effectiveness in removing these lesions. However, if you watch a video of a CO2 laser in action, you will understand how these studies are not needed, because CO2 lasers are clearly effective soft tissue ablators. Illustration 49. CO2 laser. When used for xanthelasma removal, CO2 laser's most common functionality is the continuous mode. Lasers can be really powerful, so powerful that they can also be used to cut metal. So your eyelids and plaque thickness has no real stopping power over a laser. Hence, it is highly advisable to use eyeball protectors during the laser xanthelasma removal procedure, because the high energy radiated by the laser could penetrate through the upper eyelid and cause unwanted injuries to the eyes. Freezing xanthelasma treatment. This removal treatment involves freezing the xanthelasma with liquid nitrogen or another chemical. This is also known as cryotherapy. Liquid nitrogen has been proposed as a possible xanthelasma removal treatment using cryotherapy. Liquid nitrogen xanthelasma treatment is referred to as cryoxanthelasma ablation, and you will see this option come up from time to time. However, the dangers of applying extreme low temperatures to your eyelids and the disappointing results have made this removal treatment the least favored. It is simply too dangerous, destructive, and the results are unreliable. What is cryoablation? Cryoablation is the use of extreme cold in order to destroy abnormal or diseased tissue and cells. In this treatment, the liquid nitrogen is applied to the skin in order to break the cell's walls. The liquid nitrogen also causes damage to the microvascular circulation, which results in secondary anoxia and hemorrhagic necrosis. Ideally, this will damage and freeze the offending cells and solve the problem. Cryoablation is similar to acute frostbite. Due to its deep cold delivery and dramatic results, this form of skin treatment is the best for large areas of the skin and can be beneficial for wrinkle control and skin resurfacing. As a treatment option for xanthelasma, it is far more dangerous, and the negatives greatly outweigh the positives. For these reasons, it has been widely discarded as a viable xanthelasma removal treatment. Disadvantages of freezing. Cryoablation treatment. The application of liquid nitrogen does sting. Although it's cold, many describe the procedure as feeling of burning. Cryoablation can cause the area treated to appear permanently lighter in color, hypopigmentation. Extra caution must be used when treating the face or any other cosmetically sensitive area. It is only appropriate to remove skin lesions on parts of the body that are not as delicate, like the eyelid area. In other words, it is generally effective for the treatment of fully developed skin cancers or deep lesions such as large moles, which grow on other parts of the body away from the eyelid area. Depending on how it is applied and the location of the treatment site, blisters will sometimes form during the days following the treatment, more common on the eyelids. Illustration 52. Various pictures of Xanthelasma on the upper eyelids. What is liquid nitrogen regularly used for? Liquid nitrogen, due to its low reactivity and low temperature, is used for various purposes. Some of its applications include cryotherapy when removing cancer and benign skin lesions. Skin therapies is only one of them. Freezing and transportation of food products. Cryopreservation of biological samples like eggs, sperm, and animal genetic samples. Coolant for computers, vacuum pumps, and other equipment, preventing materials from oxygen exposure. Quick freezing of water pipes to allow working on them easily when valves are unavailable. As a source of very dry nitrogen gas for branding cattle. Cooling materials to enable easier machining or fracturing. Is liquid nitrogen a good treatment for Xanthelasma? In simple short words, no. It is neither effective nor good treatment. Cryoablation destroys all the cells, that's all. Cryoablation destroys all of the cells that it comes into contact with. The resulting injury will be worse than the original problem. In case of liquid nitrogen and Xanthelasma, the cryoablation technique can penetrate right through the eyelid and can cause painful and dangerous freezing burns on the eyeballs. Do not risk your vision. This is a risky treatment option. What is electrolysis? In chemistry, electrolysis was defined as a chemical reaction. In this case, we are not talking about that chemical reaction you may have studied in the past. The name is quite deceiving. In the UK and in the aesthetic industry in particular, electrolysis is the name given to those devices that use diathermy, electrical radio frequency, which is the same technology as electrical arcing but using a return pad. This technology has been extensively used for permanent hair removal. It is important to understand that in different countries this technology has different names, but it has been referred to as electrolysis in the field of aesthetics. In other words, and to be as clear as possible, electrolysis in aesthetics is a type of electrical arcing treatment where the device used has a return pad and there is not a spark taking place. It was popular in the UK up to early 2000s, however, it is not overly used nowadays. This is because newer and more effective electrical arcing devices have been placed on the market. Electrolysis was effective in removing your Xanthelasma within 1 or 2 sessions. Electrolysis can be used to remove individual hairs from the face or body. different types of electrolysis, galvanic electrolysis. This type of electrolysis uses electrical energy to destroy the Xanthelasma, brought about using direct electrical current, DC. The needle of the instrument is inserted into the hair follicle and a small electrical discharge is administered. When the needle is inserted, the electricity that comes down the needle causes the hair follicle to die. Illustration 53. Old electrolysis device. Thermolysis. It is performed in a very similar way to galvanic electrolysis, but instead of an electrical current, the needle delivers radio energy at a designated high frequency. The thermolysis method, also known as the shortwave, works by using an alternating current of electricity, AC. This current causes heat, which in turn destroys the hair follicle when the needle is inserted inside the hair root. Blend electrolysis. Blend electrolysis, also called dual action method, is the combination and simultaneous use of galvanic and thermolysis techniques. This combination method alleviates the shortcomings of each of the individual techniques, while bolstering their advantages. The blend method combines the procedure of both the shortwave and galvanic. Electrolysis is very effective for hair removal, but it has been used to remove benign skin lesions, including Xanthelasma. Electrolysis side effects: mild blisters, mild inflammation, mild swelling, irritation, pigmentation changes, usually light patches on darker skin, immediate redness which will fade away over time. Is electrolysis effective? While electrolysis is listed as a potential treatment for Xanthelasma, it is a real effective solution which can actually remove your Xanthelasma. In order to use electrolysis for Xanthelasma treatment, a practitioner places the device's tip or needle into your Xanthelasma and then heats the needle up, repeating this process up to 15 minutes. At this point, the cautery aspect of the treatment makes the plaque appear shriveled and scorched. While it may look like it is retreating, the Xanthelasma will not go away so easily, and the treatment may be required to be repeated a couple of times in total. Garlic solutions. Garlic reduces cholesterol and blood pressure. It is not going to hurt you taking garlic in an attempt to control your Xanthelasma, as it is able to help you lower your cholesterol levels, and it has other health benefits. It is a great option to improve your health and reduce the detrimental effects of an increasing cholesterol level. Can garlic affect your Xanthelasma? Some people suggest rubbing your Xanthelasma with a garlic clove, and it may be of some benefit to your Xanthelasma. Garlic contains two key components: allicin, a sulfur-rich amino acid, and allinase, a protein-based enzyme. Many people accept garlic is a great ingredient to many recipes. Garlic may be of little benefit to some Xanthelasma patients and have many benefits to others. In short, garlic may not remove your Xanthelasma reliably. In general, you cannot count on garlic to remove your Xanthelasma. Garlic, however, is worth taking to control your cholesterol levels and potentially help you with your other health issues that Xanthelasma might result from. It may not be very effective in small quantities, therefore, you may need to eat it in great amounts regularly, and garlic has the great potential to slow down your Xanthelasma growth. Illustration 55. Garlic cloves. Benefits of garlic. Blood purifier. Tired of covering your Xanthelasma up with concealer every morning? It's time to tackle the root cause of your Xanthelasma by purifying your blood from the inside to get healthy skin on the outside. Take 2 cloves of raw garlic with some warm water every day early in the morning and drink a lot of water the entire day. This may not remove your Xanthelasma, but it can help. Cold and flu. Garlic is going to provide you relief from that stubborn cold and flu. Taking 2 to 3 cloves of raw or cooked garlic a day, or sipping some garlic tea with a touch of honey or ginger to lift up the taste, is not only going to relieve a stuffed nose and cure a cold, also build your immunity against these frequent visitors over time. Prevention of heart disease. Eating garlic on a daily basis in food or raw helps lower cholesterol levels because of the antioxidant properties of allicin. It is also immensely beneficial to regulate blood pressure and blood sugar levels. Garlic is highly nutritious but has very few calories. Garlic improves cholesterol levels, which may lower the risk of heart disease. Antibacterial and antiparasitic. Garlic is the best kept medicinal treasures of the past era. It has been used as an antibiotic to treat bacterial, fungal and parasitic infections for the last 7,000 years. Is it good for your heart? It is vital to take care of your heart health. As a result of aging, our blood vessels become hardened with time, and also the blood flow may not be as good as it is supposed to be. Sometimes this happens due to plaques and fats that are deposited within the blood vessels. They are the result of high levels of unhealthy LDL cholesterol. By eating garlic, you will reduce LDL as well as free radicals detrimental to your body. Illustration 56. Picture of a heart. Xanthelasma treatment with castor oil. Xanthelasma can be an unsightly condition that dramatically affects your appearance. These growths are not dangerous, but they may have an impact on your everyday life. Xanthelasma treatment can be long and possibly even costly depending on the type of treatment you choose. Most people would prefer a more natural way to deal with their Xanthelasma, which would lead them to consider castor oil. It is definitely worth a try. Can castor oil treat xanthoma or Xanthelasma? Sometimes your aesthetic clinic's modern treatment options may not sound very attractive. Many people have this question in mind: can castor oil treat their xanthoma or Xanthelasma? The good news is that castor oil has the ability to dissolve and break down some of the lipid buildups in your benign growths. Some people tried castor oil treatment methods, but does it work? Yes, it works because castor oil has some antibacterial properties, and in some cases it has been reported to dissolve these yellow fat deposits. Castor oil contains a natural anti-inflammatory ingredient that can automatically help reduce any swelling. This could help reduce most swellings on the skin completely with just a few applications. For a percentage of people, this oil may not remove the Xanthelasma. However, it has the ability to slow down the process of Xanthelasma migration. Castor oil contains high levels of fatty acids that can easily reduce your Xanthelasma growth. Regular application will give you smooth, younger looking skin that is free from these yellowish lesions. Castor oil is a vegetable oil which is used in a wide variety of cosmetic and medical applications. It provides health benefits for the face and skin. It is made from the seeds of resinous plants by extracting the oil. These seeds, which are known as castor beans, contain a toxic enzyme called resin. Its plant is largely native of India and Africa, while the oil is very well known all over the world for its anti-inflammatory and antibacterial properties. Castor oil contains minerals, proteins, and vitamin E. What are the benefits of castor oil? Acne. The antimicrobial and anti-inflammatory properties of castor oil make it useful in reducing acne. Ricinoleic acid can inhibit growth in the bacteria which cause acne. Texture. Castor oil is also rich in other fatty acids. These can enhance smoothness and softness when applied to the face. Complexion. The fatty acids in castor oil can promote the growth of healthy skin tissue, making it helpful in restoring an even skin tone. Illustration 58. An unhealthy skin which can be treated with castor oil. Anti-inflammatory. Castor oil has demonstrated anti-inflammatory properties. This makes it useful for treating irritated skin. Antimicrobial. Castor oil may also protect the skin from bacterial infections by keeping out microbes that can cause disease. Moisturizing. Castor oil contains triglycerides. These can help maintain moisture in the skin, making it a useful treatment for dry skin. Hydration. Castor oil also have humectant properties, which means that it can draw moisture from the air into the skin, keeping the skin hydrated. Cleansing. The triglycerides found in castor oil are also helpful in removing dirt from the skin. Castor oil heals inflamed skin. Castor oil is the perfect answer if you are looking to heal skin inflammation that can be caused by sunburns, acne, and dry skin. All you need to do is to dip a cotton ball into the castor oil and apply it on the affected area. Apply it to prevent stretch marks. Stretch marks usually occur during pregnancy when the skin on the abdomen experiences drastic stretching. The more elastic your skin gets, the lesser the chances of developing these marks. Castor oil is very rich in fatty acids, so when used during the last 2 months of pregnancy, it can help prevent stretch marks. How do I apply castor oil to get rid of my xanthelasma? This oil is high in fatty acids and can easily penetrate into your growth, causing it to break down and reduce in size. Because of the solubility of the oil, you could find that your growth rapidly disappears and loses the yellow tone associated with the condition. Soak a cotton ball in pure cold pressed castor oil and apply it onto the xanthelasma. Either massage it in or tape the cotton ball to the area to allow it to soak in. Repeat the process every 2 to 3 days. Frequently asked questions about xanthelasma removal. What is xanthelasma? Xanthelasma is a particular type of xanthoma. Xanthelasma is a yellowish formation of cholesterol around the eyes. Since these are cholesterol formations, they have no nervous terminations, therefore they are not painful to touch. However, during removal with lasers or similar equipment, the patient may feel pain due to the transferred heat to the surrounding healthy skin around the xanthelasma. Some devices are capable of removing xanthelasma without the need of anesthetic, i.e. the Beauty Tech by Areton. Will I be left with scars after being treated for xanthelasma removal with surgical excision? Scar formations are very much dependent on the level of precision of the equipment used, the ability of the practitioner. Generally, scars are likely after excision, in case the area treated has become infected or the dermis has been damaged during the excision. Manual excision using a traditional scalpel is the procedure that is the most likely to cause scarring to the patient. In the majority of cases treated with surgical lasers, beauty tech, bifurcator, or electrocautery units used in fulguration mode, no scars have been left after healing. The few cases of scarring reported have been mainly due to laser misuse, which caused considerable damage to the dermis, subsequent infection of the part after excision. Therefore, no makeup must be used after any of these procedures to avoid unnecessary complications. If I decide to have my xanthelasma surgically excised, will I need anesthetic? Some new surgical lasers operate at particular wavelengths which do not transfer enough heat to the surrounding healthy skin to cause severe pain during the treatment. However, with most conventional surgical lasers, the pain caused during xanthelasma excision could be so severe that local anesthetic becomes strictly necessary. It has been reported that the beauty tech made by Areton, as well as other state-of-the-art lasers, are now used to perform xanthelasma removal without the need for anesthetic. This is because these high technological types of equipment are capable of delivering very targeted ablative heat only to the cholesterol deposits of the xanthelasma. A xanthelasma treatment covered by the NHS in the UK. To a certain extent, it was before 2008, however, it is not now. This is due to the necessary NHS budget cuts. Xanthelasma is a benign lesion, therefore can be left untreated without causing any harm to the patient. The cost of surgical excision can start at $700 US. However, these low prices are very rare. The average price in the United States is in the region of $2,500 US for xanthelasma removal on both eyes. The USA has one of the highest priced health systems in the world, therefore xanthelasma treatment by excision can cost considerably less in other countries. Specialized chemical peels like the xanth remover cost between $200 and $300 US, and it does remove the xanthelasma without leaving any scarring. Will my xanthelasma come back after treatment? Sometimes xanthelasma do return after treatment, unfortunately. This can happen even if your cholesterol levels are normal. The only option is going through another xanthelasma removal treatment. According to new clinical studies, the area treated with the beauty tech for xanthelasma removal does not present xanthelasma recurrence. How many treatments do I need to remove the xanthelasma? This depends on the type of procedure used. Some can require multiple treatments, like with the use of cosmetic peels, but in most cases, one treatment will be enough to get rid of these unwanted lesions. If xanthelasma return at a later stage, further treatment will be required for removal. If I decide to use a peel to have my xanthelasma removed, how many treatments do I need? This is very much dependent on the type of peel you used. Moreover, size and especially the thickness of the xanthelasma. For very thick xanthelasma, you may require up to 5 treatments using potent peels. If you are using the xanth remover, one kit will be enough to treat 10 people. In very mild cases of xanthelasma, only one treatment can resolve the problem. What is the difference between skin depigmentation and scarring? Depigmentation occurs every time a wound heals. This is due to the lack of melanin in the new skin formed after a wound has healed. The texture of the new skin is somewhat different to the rest of the skin. The newer skin is pinker in color due to the lack of melanin. Will I get skin depigmentation after xanthelasma removal? Depigmentation is always a constant of xanthelasma treatment and removal. Depigmentation occurs every time the skin has healed after surgical xanthelasma excision. The peeling process is the least invasive treatment available, and the degree of depigmentation is very low compared with the degree of depigmentation after surgical excision. The depigmentation will not last very long. Like any other type of wound, it takes in the region of 2 months for the new skin to blend in with the rest. Normal sun exposure will accelerate the process. Myths about xanthelasma removal. Eating garlic removes xanthelasma. Illustration 60. Garlic treatment. Well, this one might work, or it might not. The reason being that garlic reduces the bad cholesterol levels and therefore can treat xanthelasma. But as the research shows, not many people have benefited by eating garlic in order to remove their xanthelasma. So, you should eat garlic, no doubt about that. But don't be too optimistic about the results. Xanthelasma will be back after some time. It is true that many people who had xanthelasma in the past develop them again after removal. This is because this condition is not always a mere result of a bad lifestyle and/or bad diet, but it is predominantly a genetic condition that makes certain individuals more prone to developing xanthelasma over and over again. There are also individuals who develop xanthelasma due to their poor diet and sedentary lifestyle. To those who have been affected by xanthelasma predominantly due to the genetics, xanthelasma recurrence will be out of their control. However, effective, low-risk and inexpensive treatment is now available, therefore recurrence should not stress anybody out. Illustration 61. Xanthelasma on eyelid with defrosting caused by TCA. For those whose xanthelasma are directly related to their lipids in their bloodstream, a healthy lifestyle and regular exercise will prevent the xanthelasma from recurring after removal. In some cases, it has also been shown how some individuals can literally treat their xanthelasma by improving their diet quality and taking on exercise. So, these are the lucky ones who have the power to control their condition and prevent xanthelasma from recurring. Xanthelasma is a direct consequence of high cholesterol levels. Although this is true to some extent, high cholesterol levels is a major cause of xanthelasma. But remember, it's not the only cause of xanthelasma, and close to 50% who have xanthelasma do not have abnormal cholesterol levels. Xanthelasma might also be due to genetic reasons, and some people who develop xanthelasma have had earlier instances of xanthelasma development in their families. Xanthelasma cannot be treated. This is the most common myth, and almost anyone can be heard preaching this message. Even some doctors do not shy away from telling their patients to cover up their xanthelasma with makeup as a potential long-term solution to this problem. The basis to the solution stems from the belief that xanthelasma removal leads to permanent scarring. This is not true, and there are a number of latest techniques for xanthelasma treatment that can help lead to xanthelasma scar-free removal, which includes laser and cryosurgery, to name a few. You have to live with xanthelasma and cover them up. The misconception that you need to live with xanthelasma and the only way to alleviate the embarrassment of being affected by this condition is makeup is another non-truism This myth comes from a recommendation made by a doctor on the UK TV program Embarrassing Bodies. This doctor suggested the young patient was badly affected by xanthelasma that she would be better off avoiding treatment and just use makeup to cover the yellow patches as a long-term solution. Allegedly, this was because, according to the doctor, any treatment would have led to scarring. Fortunately, this is not true, as there are thousands of people worldwide who have been successfully treated without being scarred by the removal treatment. Illustration 62. Hiding by wearing a mask and put makeup on. Given all the treatments that are available nowadays, there is no need to live with your xanthelasma and battling every day to cover them up. Treatments that guarantee low risk of scarring and high likelihood of successful removal are available. Therefore, makeup can be used only while you are seeking the right treatment for you. Xanthelasma removal will cost thousands. This myth exists because xanthelasma is a condition that has long been neglected by the medical sector. After all, it is not a dangerous condition, and keeping xanthelasma will not affect your health as such. It is mainly a cosmetic condition. For almost any cosmetic condition, those who have the most knowledge on the topic are the cosmetic surgeons. As we all know, cosmetic doctors are not selling their services cheap. The demand for their services is almost always, and almost in any country, very high. Therefore, they quote high prices for relatively easy procedures. As an example, when this type of treatment was available for free in the UK, the main procedure advised for the patient was TCA treatment. This was sensible advice, since if properly carried out, peeling treatment for xanthelasma removal is the one that guarantees the lowest likelihood of scarring at the lowest possible cost. Therefore, in the UK, many thousands of individuals had their xanthelasma removed for free using peels on the NHS. However, once the problem was passed on to the private sector, the rules of the game changed, and the purpose of the private sector is to make the most amount of profits, making the least effort. As a result, many patients have been now quoted between £2,000 and £3,000 in the UK for xanthelasma removal. Similarly, in the United States, many patients get quoted in the region of $5,000 in order to remove their xanthelasma using lasers. Therefore, instead of opting for the least cost and the least risks, the option cosmetic clinics offer to their patients is not the one that offers the least risks and the least costs. If I have xanthelasma, I am more likely to die younger of heart-related diseases. This myth is still very common. There are a number of articles on the internet associated xanthelasma with early signs of heart and cardiovascular diseases. Some of these articles even go on to state that the lifespan of those affected by xanthelasma is lower than those of the general population. This is allegedly because the processes that lead to the accumulation of fat deposits on the epidermis, xanthomas, and the fat deposits within the arteries that cause strokes and heart attacks seem similar. We believe that if you have xanthelasma and your cholesterol levels are normal, you should not worry about heart disease. It is always a good idea to take on regular vigorous physical activities like jogging, cycling, swimming, etc., just in case. This is because to date we have not been able to find a research paper backing up these claims with tangible statistical data. Therefore, do not worry about heart attacks
just keep healthy. Xanthelasma and heart attacks have not been scientifically linked, but stress and worry have been scientifically linked to heart disease. On the other hand, should you be affected by xanthelasma and you have high cholesterol levels, you are better off changing your lifestyle and diet. By lowering your cholesterol levels, your xanthelasma may even disappear, and your chances of developing heart disease and stroke will inevitably lower. Why and how certain xanthelasma treatments do not leave scars? Xanthelasma is a cholesterol formation that builds up between the dermis and the epidermis. No matter how big or deep the xanthelasma, these lesions do not affect the dermis. Therefore, it is possible to treat xanthelasma and successfully remove them without leaving any scarring. Custom peels are the least expensive and the most convenient solution to treat and successfully remove xanthelasma without leaving any scarring. The two main precautions to be taken in order not to cause any scarring after any type of dermatological ablations are: the dermis has to be left unaffected by the treatment, no infection has to develop after the treatment. This is feasible thanks to modern medical equipment, which makes possible to ablate the skin tissue with a high degree of precision not previously possible with a manual scalpel. This high level of ablation precision allows the operator to leave the dermis intact. This is why laser, hyfrecator and other instruments are very effective when removing xanthelasma without generally leaving any scarring. Illustration 64. Deep xanthelasma laser ablation on the left eyelid. Healing by secondary intention. However, in some cases, it is advisable to try and remove the whole lesion within one session unless the xanthelasma are still shallow. If the xanthelasma have grown particularly deeply into the skin, it is not advisable to remove them within one session, even by using sophisticated medical equipment, because this will very likely cause scarring. Therefore, in case you are trying to remove a thick xanthelasma, it is not advisable to do it within one session, because the treatment could be too aggressive and damage can be caused to the dermis. The patient in the right picture inevitably developed a scar on the eyes because the excision was far too deep. This was done with the clear intention of removing the xanthelasma within one session. This was not advisable, and the patient should have undergone at least a couple of sessions instead. Illustration 65. Inevitably, the patient will develop a scar on the under eyelid area because the excision was far too deep. The first session should be used to get rid of the main bulk of the xanthelasma, followed by at least 6 weeks of healing. The 6 weeks of healing would have allowed the natural tissue regeneration necessary to treat the patient again and leaving the dermis intact and therefore leaving no scars. Pushing for xanthelasma removal within one session is common practice in private healthcare and cosmetic surgery. This is simply because the quotations provided are generally for complete xanthelasma removal, and the less number of treatments, the bigger the margins. Due to modern specialized equipment, the dermatologist has all the instrumentation required in order to remove the xanthelasma, leaving the dermis unaffected and therefore minimizing the risks of developing scars. However, when the xanthelasma are very thick, it is always advisable, as shown in the above picture, to undergo multiple sessions instead of rushing into removing the xanthelasma within one session. Illustration 66. Xanthelasma gone without leaving any trace. When the dermatologist proceeds to remove xanthelasma, he will be able to selectively target the cholesterol deposits, leaving the dermis intact, provided that the xanthelasma is not too thick. As a consequence, unless subsequent important infections occur before healing, the likelihood of scarring is very low. The same level of precision is possible with specialized medical equipment, and now also possible using the customized xanth remover. If you apply the xanth remover as directed, it will target exclusively the superficial part of the skin and the xanthelasma, leaving the dermis intact. Additionally, when using the xanth remover, the risks of infections are extremely low, as the xanth remover does not cause any open wound. Consequently, the risks of scarring are even lower by using the xanth remover than any other type of excision. Please note that, although the risks of scarring can be minimized, no treatments to remove xanthelasma can guarantee no scar formation after removal. Xanthelasma prevention. How to prevent xanthelasma from reappearing? The only way to prevent xanthelasma from reoccurring is by keeping your cholesterol levels low. This is done by eating less and eliminating meat consumption. Eating high proportion of fruits and vegetables. Exercising regularly. Keep your BMI as low as possible. Leading a stress-free life. No smoking. Leading a healthy lifestyle does considerably lower the chances of xanthelasma reappearing after removal. Unfortunately, it is not known why certain individuals experience xanthelasma recurrence despite conducting a healthy lifestyle and keeping their cholesterol low. In many cases, genetics play an important role in the formation of xanthelasma. Therefore, all you can do is maintain a healthy lifestyle. You should not get upset if they reoccur. It has been reported that applying garlic slices once a week decreases the likelihood of xanthelasma recurrence. Apparently, the area where the xanthelasma usually appears needs to be covered by a slice of garlic for 10 minutes. The slice must be cut in half so that the juice will be in direct contact with the skin around the eyes. The following day, the skin will redden and swell. Allegedly, this has prevented xanthelasma from recurring. Please note that there is no scientific evidence to corroborate the efficacy of this method. However, garlic is harmless and inexpensive, and hence worth a try. After all, if the xanthelasma reappear, all you can do is to have them treated again. And this is easy and inexpensive. Xanthelasma and recurrence. Xanthelasma can recur after removal. Therefore, when you are selecting the xanthelasma removal treatment, you should consider the possibility of recurrence, because this can happen even when the removal has been carried out appropriately. In fact, even if xanthelasma has been removed properly by using peels, lasers, electrofulguration, etc., they can reappear a few months after the cosmetic treatment. According to a published study, the recurrence rate measured 2 months after treatment was nearly 15% of the total number of people who underwent removal with a CO2 cosmetic laser. The recurrence rate is expected to increase 6 months to a year after removal. Recurrence is an issue in xanthelasma removal. Unfortunately, we cannot be sure that once it's removed, the xanthelasma will not reappear. Looking at the causality of xanthelasma, this appears to be familial. Also, xanthelasma, both periorbital and eruptive, mostly do not go away unless removed. Xanthelasma removal can be very frustrating due to the recurrence rate. The study shows that after 2 months of CO2 laser treatment, meaning removal by laser ablation, for periorbital xanthelasma, nearly 15% showed no improvement. Illustration 67, Xanthelasma on upper eyelid. This means that despite the complete ablation of the Xanthelasma 2 months later after Xanthelasma returned in 15% of the total cases in the study, a further study goes into the investigation of Xanthelasma recurrence after removal treatment. In this study, it is assumed that the recurrence rate increases 2 months after removal. In other words, if, for example, the recurrence rate is found to be 15% after 2 months, this percentage rate could increase after 6 months or 1 year. Remember that, in any case, there is no guarantee that after complete removal, the Xanthelasma will not recur. For this reason, some of those who undergo Xanthelasma treatment may require to undergo further sessions, as these unsightly lesions may reappear at a later stage. Xanth remover. The xanth remover is the most effective, one of the safest and most inexpensive Xanthelasma removal solution. Many people around the world have now removed their Xanthelasma by using the xanth remover. The xanth remover is safe. It is developed in a gel-like consistency to avoid drips. It is an amazing cosmetic peel which does not burn like any other glycolic-based peel. It delivers the depth of peeling you want depending on the timing of the application. The longer you keep it on, the deeper the peeling effects. It is manufactured, packaged, and labeled by an ISO 22716-2008 laboratory. It is a cosmetic peel made to remove Xanthelasma. It is not a medication. Safe thanks to the peel types we use in the xanth remover, it is safe for home use. We do not use TCA. The only peel whose effects can be stopped by simply wiping it off and rinsing it with water may not be possible with alternative TCA peels available. Inexpensive, very unlikely to leave scars, easy to use, saves tons of time and money. It even removes thick Xanthelasma in 80% of the cases. Xanthelasma recurrence rate 20%. However, in this unlikely case, the xanth remover can be reapplied onto the new Xanthelasma and removed again. What are the ingredients? The xanth remover is based on different types of peelings depending on your type of Xanthelasma and skin type. The most common are based on glycolic acid and vitamin A and other natural ingredients that selectively help dissolve the fat present in the Xanthelasma. We are using 2 main ingredients. One is glycolic acid at a high percentage in the region of 70% to 95%, and the second is vitamin A at its highest allowable concentration. The xanth remover is also a service. We can assist you online throughout the whole removal process until the Xanthelasma are gone. You can also opt for the money-back guarantee option. Why is the xanth remover safer and better than any other peels for treating Xanthelasma? Generally, there are very low risks in applying specialized peels to achieve complete Xanthelasma removal. Peels are generally the preferred option for Xanthelasma removal. This is because they are inexpensive and proven not to cause scarring if used properly. The peels that you find online may have lower quality control behind them, especially because you usually get what you pay for. They lack the special additives that are required to make the treatment safe at home. What type of peels is right for your skin? What is the best peel concentration for your skin type? If you have any question, do you think other merchants will be able to help you with useful information about Xanthelasma removal if you are in need of it? Instead, we can help you throughout the complete removal process. Alternative cosmetic peels can easily cause dangerous drips during the application. Additionally, they do not have the same effectiveness in the treatment of Xanthelasma as the xanth remover. The areas affected by xanthelasma are generally more delicate than other parts of your skin. Therefore, you want to make sure that the solution you are applying close to your eyes is of the highest quality and not too corrosive or damaging. This is one of the reasons why the xanth remover is customized to accommodate your skin type in xanthelasma. The xanth remover is better than any other treatment for xanthelasma because it is safe thanks to the peel types we use in the xanth remover. It is safe for home use. We do not use any TCA. The xanth remover has been developed to minimize the likelihood of contact with the eyes due to its gel-like thick consistency. This will minimize the risks of drips formation during its application. The ingredients selected are guaranteed to be of the highest quality to remove xanthelasma on one of the most delicate parts of your skin, your eyelids. If you have any question about your cosmetic treatment after purchasing the xanth remover, we are here to help you with our advice. All you need to do is just email us your up-to-date pictures and we will answer your questions and we will advise you throughout the treatment. The xanth remover formulation history. Initially, we used TCA in our xanth remover, but very soon we found an issue with that. The problem is that 1 or 2 days after the xanth remover was applied on the upper eyelids to remove the xanthelasma, severe swelling would develop. This was worrisome to most people, although the swelling would subside on its own within 5 days to a week at most. However, TCA is relatively difficult to control as it is best used with an appropriate neutralizer. Immediately, we noticed this problem and we started working towards a solution. We carried out some research. Unfortunately, we found a study published by a Japanese university. In that research paper, it was mentioned that a 90% glycolic acid solution was used to successfully remove xanthelasma with an extremely high success rate. So we have asked one of our labs to make a glycolic acid based gel with a high percentage of glycolic acid in the region of 70 to 95%. In the early stages of the glycolic acid based gel, we found that it was an effective solution, but still, the glycolic acid was not as effective as TCA. So we needed another ingredient to make this product better, and vitamin A is the ingredient which we were looking for. We did further research on vitamin A and we found that vitamin A is allowed in cosmetic products within a certain percentage. So we are using nowadays vitamin A and glycolic acid in the xanth remover. So basically, we are using two main ingredients. One is glycolic acid with a high percentage in the region of 70% to 95%, and the second one is vitamin A with its highest allowable concentration. Other ingredients: water, C13, C14 isoparaffin, laureth, sodium hydroxide, propylene glycol, capric triglyceride, retinol, vitamin A in the new glycolic acid-based xanth remover. On top of the great results of glycolic acid-based xanth remover, we wanted to make the product even more effective in removing your xanthelasma. We wanted to make it in such a way that it is effective in removing any type of xanthelasma and at the same time make our system very efficient in order to pass the cost cuts to you, our customers. The new xanth remover with vitamin A is a standard product now that works on all types of xanthelasma and skin types. So, How does vitamin A help us achieve this? Vitamin A in skin products has cellular stimulation properties that makes it a potent exfoliant. The glycolic acid has the double function of dissolving your xanthelasma and at the same time opening the xanthelasma tissue to vitamin A. Once vitamin A gets in contact with the base of your xanthelasma, then the cellular stimulation takes place. As the cellular stimulation takes place, the xanthelasma gets detached from its base and it is removed, leaving in its place a hole, which is going to heal by secondary intention. One of the several advantages of using the xanth remover is that you can decide when you are satisfied with the results. If you think that you still want to keep removing a tiny xanthelasma residue, you can still do so. You are in control of your treatment and you can continue until complete removal. How does it work? The xanth remover is not a miracle cure, it just works. But how does it work? The xanth remover works by chemically ablating the xanthelasma from the top. In other words, the xanth remover destroys the fat deposits of the xanthelasma. As you apply the xanth remover on your xanthelasma, you will feel a burning sensation. This is normal. This burning sensation will only last 5 minutes. After that, the area where you applied the xanth remover will have whitened if you used our early TCA formulation. No whitening will occur if you use our glycolic acid formulation. Make sure you only apply the xanth remover on the xanthelasma and not on your healthy skin. Illustration 70. Watch our video on this topic. This is one of our selected individuals of our clinical tests before the xanth remover was applied. This is the same patient soon after the xanth remover was applied. At that point, the burning sensation was gone. As you can notice, the area where the xanth remover with TCA was applied had whitened. This whitening reaction is normal after applying the xanth remover. A few days later, the part where the xanth remover was applied will have hardened and will have turned into a scab. Please note that some patients experience swelling after applying the xanth remover. This is very normal. There is nothing to be worried about. Swelling will go away after a few days. Illustration 71. Xanthelasma soon after the TCA-based xanth remover was applied. Illustration 72. Patient just after the TCA-based xanth remover was applied. The burning sensation was about to fade. After a few days, the scab will fall off by itself. At that point, you will see that the thickness of your xanthelasma will have decreased drastically. After a few applications, you will get rid of your xanthelasma completely. So, you will be able to notice the improvement almost immediately. Depending on the thickness of your xanthelasma, some patients require more treatment and others require fewer. Illustration 75. Scab will fall off by itself. As you can see, the area where the xanthelasma was is pinker than the rest of the skin. This is normal because new skin has replaced the xanthelasma. After a couple of months, the color of the treated part will have blended with the rest of the skin due to normal sun exposure. The new glycolic-based xanth remover. How does it work and what is the difference from the TCA formulation? The new xanth remover removes any type of xanthelasma and can be used on any skin type. After using the TCA-based xanth remover on a number of customers, we realized that we needed to find an active ingredient that would not be as difficult to control as the TCA-based xanth remover. The problem was that the xanth remover was the first product of its kind for home use. The drawbacks of TCA, despite its proven efficacy in removing xanthelasma, are: when it is applied on the upper eyelids, it causes severe swelling on the upper eyelids and lower eyelids. Although the swelling subsides in all cases, this is still worrisome to most people. It presents risks of permanent hypopigmentation in skin types 4, 5, and 6, the darkest skin types. TCA is usually not recommended on dark skin types due to the risk of having permanent discoloration on dark skin into a whiter patch after the use of trichloroacetic acid. It is difficult to stop its ablating effects unless an appropriate neutralizer is applied. The risks associated to TCA are a lot higher than other active ingredients, and if it gets in contact with the eyes, it can be quite dangerous. The product is not very stable in a thick gel-based formulation. What this means is that after a few months the TCA gel turns into a liquid. As mentioned elsewhere, after conducting our research we found a study made in Japan stating that the Japanese researchers have had success in removing Xanthelasma using glycolic acid at a high percentage, namely 90% concentration solutions. We knew that glycolic acid was easier to use and milder than TCA without most of the side effects and risks of TCA. The advantages of glycolic acid are: does not need a neutralizer as TCA does. Glycolic acid gel does not cause the severe swelling caused by TCA 1 or 2 days after the applications. There has not been reports of hyperpigmentation on darker skin types. The effects of the glycolic acid-based gel can be stopped without a neutralizer by simply wiping it off and rinsing the area with water. The depth of penetration of the gel into the skin can be regulated by changing the timing of the application. The longer you keep the gel on, the deeper the effects on the Xanthelasma and the skin. It is not as dangerous to the eyes as TCA if it gets in contact with the eyeballs. Case study on how to apply the glycolic acid-based xanth remover. Illustration 75. Watch our video on this topic. The xanth remover is a specialized cosmetic peel and customized to remove your Xanthelasma. The xanth remover is very easy to apply. Please note that the following does not apply to TCA, and we have stopped using it in the xanth remover. The effects of TCA are generally more difficult to control than the types of peel used in the xanth remover. What are the effects produced by a particularly mild formulation on these benign lesions? The Xanthelasma on this customer was not particularly thick, and therefore there is no need for the formulation to contain any TCA. The Xanthelasma underneath the left eye is evident. However, there is also a little formation of fat appearing on the lower part of the lower eyelid. In some cases, when the best solution for Xanthelasma removal is the use of TCA, it is advisable to add milding additives in order to make the formulation as safe as possible. This is because TCA is not very easy to control and it has been partially restricted in certain countries. This is the classic case of Xanthelasma in an individual aged between 30 and 40. As many other cases, also in this case, the Xanthelasma are not correlated to high cholesterol levels. Illustration 77. Xanthelasma before. Angled picture. Illustration 78. Xanthelasma before angled picture. Illustration 79. Xanthelasma before picture. Illustration 80. 2 Xanthelasma on the left eyelid. After treating many female customers, we have found a good number of patients who have reported the development of the condition soon after giving birth to the first or second child. In the pictures above, 2 Xanthelasma are prominent on the client's left eyelid. The typical Xanthelasma on the upper eyelid close to the corner of the eye, and another on the lower eyelid also close to the corner of the eye. Illustration 81. Xanth remover blob applied on the xanthelasma. Illustration 82, very small xanthelasma on the lower corner of the right eye. There are two main ingredients, one is glycolic acid and the second one is vitamin A. The client applied a blob on every xanthelasma as shown in the right side picture. It is important to apply a small blob and leave it on the lesion for a period of time. Illustration 83, xanth remover applied on the xanthelasma. Depending on the xanthelasma, type of formulation and skin type, we instruct the customer to keep the blob for a length of time varying from 30 minutes to complete absorption, which is 1 hour. The longer the gel is kept on the lesion, the stronger the peeling effects. Please note that TCA solutions bought from other sources do require the use of neutralizers a certain length of time after the application. Illustration 84, xanth remover applied on the xanthelasma. It is also very important not to stand upright when applying the blob. This is because gravity could have the blob to slip down to places where it should not go. Therefore, we recommend to lie down at all times while you have your xanth remover blob on. In some cases, depending on where the xanthelasma are located, lie down may not be the best option. Remember, as a general rule, that gravity has to point towards the xanthelasma so that the blob will be naturally kept in place and not slip elsewhere. Highly recommend having someone else to apply the xanth remover blob for you. If you have xanthelasma on the upper eyelids, it is important to keep your eyes shut over the length of the entire application. This is because if you accidentally open your eyelids, the blob could spread to other areas where it should not go. Once again, it is important that you're not alone while you have the small blob on, because the other person can supervise the cosmetic treatment and monitor whether the blob is still where it should be on the xanthelasma. The other person will therefore help you by monitoring the gel and keep a clean cotton cloth at hand and make sure that the gel does not slip anywhere else. In case the gel escapes, the other person can wipe it off immediately. Also, given that most likely you need to keep your eyes shut during the peeling with the xanth remover, the other person can help you in case you need anything, like bringing you water or whatever else you need. Moreover, the other person can reduce the length of the cosmetic peel period and wipe the gel off at the right time, as stated in the instructions. Illustration 85, xanthelasma as the xanth remover had just been wiped off. We requested this client to deliberately wipe off the gel after a predetermined length of time. This was to stop the peeling effect. In the above picture, you can see the customer soon after the xanth remover had been wiped off and the peeling effect deliberately stopped. This was possible because the formulation was not TCA based. Illustration 86. Xanthelasma 3 hours after the ablation using the xanth remover. This is the picture of the xanthelasma in which the xanth remover formulation was wiped off after 3 hours. It is clearly possible to note that the area where the xanth remover was previously applied had started reddening. This is a very normal reaction. However, the patient never experienced any swelling because the formulation we used was not TCA based. Normally, the use of any TCA based formulation causes also swelling of the area treated, not possible to note with the use of this particular formulation. Illustration 87. Xanthelasma 1 day after the use of the xanth remover. Xanthelasma 1 day after the use of the xanth remover. 1 day later, the area where the xanth remover formulation was applied showed further reddening. However, no swelling. When using TCA-based formulation, the swelling starts to appear the following day after the application and lasts up to 1 week at most. Illustration 88. 3 days after using the xanth remover. 3 days after using the sunf remover. Only 3 days after the application of the sunf remover, the reddening had started to disappear and the area started to heal. Illustration 89. Xanthelasma 3 weeks after the ablation using the sunf remover. Xanthelasma 3 weeks after the ablation using the sunf remover. 3 weeks after the application, all xanthelasma disappeared with the exception of the left lower eyelid. That is still visible with some traces of the previous lesion. Illustration 90. Xanthelasma 3 weeks after using the sunf remover. In the above picture, it is easy to note how the previous xanthelasma on the left upper eyelid had disappeared. Of course, it is possible to note that the area where the xanthelasma was located could be mistaken for a scar. However, this is the new skin that had regrown, which has not been pigmented by the sun exposure as yet. In this picture, it is possible to understand how a single application may not be sufficient to eliminate the xanthelasma completely. Illustration 91. Xanthelasma removal after a total of 4 applications. The xanthelasma was removed, leaving no trace. After xanthelasma removal, what happens after the xanthelasma is gone? As it is well established now, properly formulated peels to suit each specific skin type and xanthelasma do not cause any scarring. Of course, this is because the ablation does not reach the deep parts of the dermis. However, after the xanthelasma has been ablated, the new skin grows instead of the previous xanthelasma. Initially, the new skin will have a different texture and will not be pigmented as the rest of the surrounded skin. Sometimes this difference in skin texture and color is mistaken for a scar. Why is that? Now, do you remember when you had a superficial wound and it healed without major complication, i.e. infections? As it may have happened to you in the past, after a superficial wound healed and the scab fell off, the new skin looked very different from the rest. Additionally, you may have also noticed that the new skin, which had formed at the time, might have also looked slightly raised compared with the surrounding skin. At a certain point, you would have forgotten about the wound altogether, busy with your daily life commitments, and a few months later, you found that the area had blended in with the rest of the skin. How does it work? If the xanthelasma had been ablated properly, the different skin texture will fade away over time. The difference in skin texture can last between 2 to 6 months, depending on the individual. The good news is that it is very easy to accelerate the blending process so that people will never notice that any treatment has ever been performed on the eyelid area. The best solution is the use of mild peels followed by a lotion containing growth factors to accelerate the natural skin regeneration process. It is very important to select the right peel for the skin type on the eyelid area. Illustration 92. Watch the related video. Of course, the type of peel to be used in order to accelerate the blending process is very different from the one used for the ablation of the xanthelasma for its removal. Moreover, the eyelid area is more sensitive than the rest of the face, hence the peel should be milder than any other peels used for skin rejuvenation. It is well known that the function of beauty cosmetic peels is to mildly ablate the epidermis and stimulate the fibroblasts. In this way, the natural regeneration kicks in. However, if regrowth is to be accelerated, a hydrating cream with growth factors should be used soon after the old skin had been peeled off. It is normally suggested to use hydrating cream because the immediate after effect of cosmetic peels are often dry skin. Also, sun protection should be worn during the skin regeneration period. This is because if the skin is exposed to the sun while regenerating, the ultraviolet rays are more likely to damage the DNA and therefore cause cell mutations. This is the main reason why, following prolonged sun exposure after the use of cosmetic peels, the likelihood of developing sunspots increases dramatically, hence defeating the whole point of using peels in the first place. Therefore, after the Xanthelasma removal treatment, in order to accelerate the blending process of the new skin grown soon after the Xanthelasma ablation, the following protocol can be carried out. Apply the appropriate peel on the whole face. It is important that the patient starts applying the custom peel starting from the eyelid area and spread it over the rest of the face. After the old skin has completely peeled off, apply sunscreen twice a day, once in the morning and once after lunchtime. The application in the morning will protect the skin from occasional sun exposure throughout the morning. The application soon after lunchtime, roughly at 1 p.m, will protect the skin from occasional sun exposure throughout the afternoon up to the evening. Apply a hydrating cream containing growth factor. The growth factor will stimulate and catalyze the natural regeneration process of the skin. This booster can be applied once in the evening so that the cell regeneration will occur during the night once sun exposure is not possible, therefore minimizing the risks of sun damage. Xanthelasma removed in Singapore. Our Xanthelasma removal service has a worldwide reach. We removed Xanthelasma the world over. This is a customer from Singapore. Illustration 95 and 96, Xanthelasma before the xanth remover. We are now moving away from TCA-based formulations for Xanthelasma removal. This is because some of our customers found TCA too aggressive. Therefore, after many clinical trials, we developed less aggressive formulations without the need for TCA. Our formulations selectively destroy the fat deposits in the Xanthelasma. We still send TCA formulations, but only from time to time and only in those cases when the skin type permits it. Mr. Thung in Singapore purchased the xanth remover online, selecting the full money-back guarantee. The majority of our customers select the least expensive option. Once he received his custom formulation, he applied it at home as instructed by Areton. These are the pictures taken only a few days after the first and only application. Illustration 97 and 98. Only a few days after the custom xanth remover application. As it is obvious, there is no swelling, always common denominator of laser treatment, and the ablation is very superficial and affecting only the old fat deposits. This is all thanks to the customized non-TCA based xanth remover. As it is possible to appreciate from these pictures, the old fat deposits have been replaced by the new skin, which has no pigmentation. Over time, this hypopigmentation will disappear due to normal sun exposure. Illustration 99. The ablation is very superficial. This shows how the correct use of the right formulation does not require the expensive and invasive surgery for safe removal of Xanthelasma.
The end.